Ah, Today I will tell about why egg minute. Ah, Today I will tell about the 25 important things which these new generation mothers think that it is normal and they don't inform the doctor. We are finding it very difficult to analyze the history of these things. 25 important point means it takes a lot of effort to remember it. So I will tell you first main thing is the mothers don't tell about nipple injury. A nipple injury, why does it happens? See, suppose the small nipple is going just into the small mouth of the baby. Then if with using this, there may not be teeth, but the baby will use the gums and nipple to express the breast from the breast to suck it out. So at that time you will be injured. So that is very important. So sometimes the injury to the nipple is caused because the nipple is just going into the mouth. For that, what you need to do is you will have to see a video of best beginnings. I will put the link in this below this in the for the proper technique of how to breastfeed. The nipple along with a part of the black area should go very much into the mouth of the baby so that it touches the soft palate. Nipple touches the soft palate. That is very important. Second is back pain. The mothers usually hide from the doctor, or they think it is normal to have back pain and shoulder pain and neck pain while feeding the baby. This is not correct. Then the third thing is shoulder pain. Shoulder is also a very important thing. If you have shoulder pain. Fourth thing is arm pain. Arm pain is also bad. Pain in the elbows and arm, these are all bad. These are due to lack of positioning. The position is not correct. The mother is bent for feeding the baby. At that time you get this strain of it. Okay? At that time another thing what happens is the stomach is compressed if you are sitting like this for feeding. So if you are sitting like this for feeding, the stomach is compressed. You need to sit straight with enough support. That is very important. If that is not happening, what will happen? Your stomach get compressed because of bent spine. At that time you will feel a vomiting sensation because already you have taken water. Now the quantity of water, approximately 3 liters of water is required. Without 3 liters of water, you can't produce quality milk. For that, what you need to do, remember, every time the baby might be asking for feed at this point of time. Before 15 minutes of that expected time of feeding, you need to drink 2 glasses of water. And third thing is lack of spices in the water. Jeera, that is cumin, saunf, that is fennel, and methi, that is fenugreek. And sometimes some people put some garlic also, some ginger, turmeric. So depending upon the climate, sometimes methi can be increased during winter climate because it is warm in nature. It is pro-metabolic. Jeera is cooling effect, so you can increase it in summer season. So adjust it according to the turmeric is neutral as well as a bit colder, and it has all properties. It will warm, cold, everything is there. So that is okay. You can adjust this solution, put lot of spices and increase the galactogenic property. Another thing is herbal medicines like lactantia, lactonic, lactare, onergy. There are a lot of herbal solutions which contain sadavari and asparagus and these things. These things you will boost the immunity. These mothers may not take these herbal things. Another thing is nuts. Nuts are important to produce milk. Like panjiri, they reduce the amount of ghee and reduce the amount of what you call it as nuts. The wheat, the dalia and other things, and increase the amount of spices and these nuts. Okay, every seed will have a property to increase the milk. Another important thing which is the proper technique. Sitting erect is also important, and you need to keep the neck a bit extended so that the nose of the baby won't get blocked. And then when the mouth of the baby is opened, then only push. Don't force the nipple into the mouth of the baby. Then it will be, the baby will bite it and break it and you will have play. Sometimes flat nipple or inverted nipple might be there. Please, you may not have to handle this now itself, but what you need to do is you need to inform the gynecologist early enough. You need to inform the gynecologist early enough so that they will give a syringe by which you can pull it out. You need to, but after delivery you are not even informing the pediatrician and you are telling I have inverted nipple. Then also we can help you. It is better late, but you need to inform that nipple is a bit flat or inverted. Then we can easily solve it out. Now, point number 10. So I'll repeat till now. We will have to have a revision. Everybody will forget. So nipple injury, back pain, shoulder pain, arm pain, liquids, synchronization of fluids, spices like genus of methi, herbal preparation like onergy, lactantia, lactare, lactonic, and proper technique of attachment and proper technique of getting the nipple back into the soft palate, and flat nipple and inverted nipple. So these 10 things we have discussed. Now we will go for point number 11. That is during feeding, before feeding, please remove the gas. You need to remove a lot of gas using stomach massage. If you don't remove the gas, then the babies won't be set up. And another point which I have mentioned is point number 12. That is you don't compress your stomach. Okay, the position, don't compress your stomach. Okay, another thing which ladies think it is normal is sleep. Okay, somebody was calling me. Sleep deficit is a bad thing. Sleep deficit is not correct. If you have, you need to sleep with the baby. As much rest you have to take. If you have sleep deficit, you want to stop the night duty of the baby by 2.5 months. Baby will have to have a prolonged sleep like 6 hours, 7 hours, like that during the night time by 2 months. How can you do it? By keeping the baby in extra sunlight. This is my point number 13. Extra sunlight is required. If there is no sunlight, then the melatonin won't be there. Extra massage, that will also stimulate. The more the baby is relaxed, less of crying. Crying causes and tension causes more of melatonin, and baby will be awake at night. The baby need more communication. Okay. For that, the mother need to have less tension. Oh, tension, what is it? Tension is because of negative energy input from the environment. Sometimes the doctor also get confused, because if parents are not telling the doctor will also tell what is happening, why the milk is not coming. So that kind of situation also, we might also get over anxious. Why, what is happening? Why the mother is requiring extra milk? Extra milk is not required. Every mother has enough potential to produce high quality milk. It is just because of more of negative thoughts, tension coming up, negativity coming up, these negative thoughts, tension, and this will over a period of time become huge volumes of wrong memories, wrong thoughts, thereby decreasing the mother's potential to produce high quality milk. So negative thoughts, tension. So we have reached point number 17. Now lack of massage. The mother need massage, baby require massage. These massage will stimulate the baby to sleep more. The mother massage of the shoulder, massage of the elbow, massage of the arms, massage of the back and neck and upper neck and head. These massages will get the mother to feel okay. This relaxation will produce high quality mother milk. And we have already talked about gas. Gas required a few more techniques like cycling, catching hold of the both the legs of the baby and doing the cycling, and then you will have to massage the stomach clockwise. So these things you need to remove the gas of the baby. The gas also require the mother to consume less of cauliflower, broccoli, dal products, and these legumes, and even milk and milk products also produce more of gas because of high lactogen content. So these food items, I'll repeat, garlic and onions and broccolis and cabbages and cauliflower and dal products, these you need to reduce or balance it, then sprout it and use it. So such a way you can reduce the gas in the baby, and milk products and other things also you need to reduce the gas. Another thing is spit ups. Spit ups has many reasons. One is gas, another thing is the mother is taking these food items, another thing is the baby is not properly burped. Somebody need to burp the baby. Okay, that's then like that. Now point from 11 to 20 we will discuss again. Recap, revision is very important to revise. That is sitting abnormally so that you are compressing your stomach and you might vomit. And point number 2 is a lot of tensions and worries. 3, lot of environmental negativity. 4, lack of sleep. And 5th, emotional sensitive personality. And 7, lack of sunlight. And 8, lack of sleep of the baby and mother, sleep deficit because baby is not getting massage, mother is not getting massage. And another thing is lack of massage of the mother and baby, and lot of gas being produced, and lot of spit ups. Okay, so we have almost discussed about 20 points right now. Okay, so this is revision is done. Now final few more points which is very unique for me, that is overstimulation. So baby is getting overstimulated. The somebody is creating a lot of noise, lot of Wi-Fi, lot of mobiles and gadgets, and lot of chumma chatti. Baby is trying to sleep. People are doing in Punjab. It is kind of lot of pyar, lot of pyar. Pyar means when the baby is ready for pyar, then you love the baby. When the baby is trying to rest and relax and sleep, if you keep on doing then what is it? This is not love. This is like you are showing your love, but baby is trying to get a rest. The baby may not perceive it as love. So this is kind of overstimulation. Lot of people giving their opinion, lot of loud noises and other things happening, no rest happening. So this overstimulation you should avoid. Temperature extremes in this North India and also in South India. South India people, babies are usually with some chaddi or no chaddi. They are because of temperature is always warm and humid. But in North India, the fluctuating temperature, there will be a lot of temperature fluctuations. If the temperature goes above 28, babies will be unhappy. If the temperature goes below 22, the babies will be unhappy. So such strict maintenance might be required for North India. If extra layer, one layer of cloth will be there, then some babies will become so much irritated. There will be rashes and small spots and another thing. Another thing is the rashes over the face and body. This irritate the baby. Heat rash might be then, allergic rashes like atopic dermatitis might be there. These irritating rashes will irritate the baby. Another fourth important thing which is mistaken is not proper clothing. The clothes might be irritating clothing. Okay, so for that it is very difficult to find out, but you should use very cotton cloth and soft cloth for these baby, very soft clothes. Otherwise these small irritations will make the baby so irritable. And another point which is very important is bottle fed baby. The bottle will have gas. Bottle produce an abnormal bacteria in the stomach, lower the immunity. Bottle is not a substitute for mother. So bottle fed babies are irritated because bottle takes 2 minutes for you to mix and other thing. By the time baby will be so irritated. Another point is the mothers are not able to identify the pre-clues. Before asking for feed, baby will look here and there and up and either for looking for searching for mother, and they'll make like this either. They are asking for feed. If you can't understand this pre-clues, within few minutes baby will make like this. Where is my feed? They'll become so angry. They'll become so irritable. That babies over a period of long time will become very fussy. So these things you need to understand. So I'll repeat 5 more points which people might forget. Which people might think normal, but it is not. Pre-clues. Making faces like this are pre-clues. You need to identify it very early so that before the baby cries you can do it. And another thing is bottle feed. Bottle feed is not a substitute for mother. It is very inferior. It has immunity lowering qualities and other thing. How much ever they try to modify, it won't give the best bacteria. The best bacteria is the mother bacteria. Another thing, overstimulation, lot of input and extremes of temperature, not able to maintain the temperature. Okay. These things are very important. Calm and cool environment, identifying the pre-clues. So I'm not going to revise the whole 25 things again. So I'll put a list up in the comment section as a PD or as a photo or something like that. You can go and refer it. I'll do it after a few minutes. And this is very simple thing. These are the normal things which parents think is okay to bear with, but this is abnormal. These are things which you need to take care. If you take care of these things, you will have the best milk and best baby around. No bimari, no autism, highest immunity. Share my videos. Take care. I'm sorry this is a very long video because this has a lot of points, 25 points. So take care. Have a good day. God bless you all.